Okay, my name is Michael. I'm going to be doing a Heent assessment today. While doing this, I'm going to obviously, when I come in, I'm going to check and make sure that everything is in its correct and proper place. I'm going to have my equipment. I'm going to provide privacy and wash my hands. And I'm going to go ahead and observe the patient while I'm coming in and to get what information that I can while I'm coming in. So, might look at personal hygiene. I look at their dress, I look at their mood, their speech, their hearing, and listen to their hearing to see if they're responding to me appropriately. Any physical deformities that might be noticeable right off the bat. I would also look at their posture and position. And then as I'm talking, I can go ahead and gain some information like their level of orientation and how well they're hearing me and how well they're seeing me as well. So, is the patient making eye contact? Yes, the patient is making eye contact. And in this case, this patient has a level of consciousness ×4. They're alert and oriented. They know the reason that they're here, and they know where they're at and the time that it is. So they are oriented. So the first thing that I would do is go ahead and to inspect their scalp and to make sure that I don't see any obvious deformities there. And then also, just as I'm doing that, go ahead and look at the face to make sure that the symmetry is in proportion, and the hair, there's no issues with the hair as far as growth patterns being abnormal or anything like that. And then the cranium itself. So I might palpate it a little bit, see if I feel anything along the suture lines, and I don't feel anything there. And then again, face symmetry as I go, and skin throughout the entire assessment. So I'm looking at their skin. Their skin is consistent with their ethnicity. I don't see any damage to the skin. I don't see any wounds. There's no scars. There's no piercings. There's piercings on the ears, but there's nothing beyond that. And I just don't see any damage there. So the face is symmetrical. I'm also looking at the ears. The ears are symmetrical. They line up with the eyes like they should. And then I'm going to go ahead and then palpate the temporal artery. Okay? And then the temporal mandibular joint as well. And then the maxillary and frontal sinuses. And so, is there any pressure? Is there any pain? Is there anything that you're having problems with? Okay. Go ahead. All right. So, while we're testing the face and we're looking at different things that could have issues with, like with hearing and vision, I want to go ahead and test their field of vision. So I'm going to come up from the side, wiggle my fingers.
No.
Okay.
No.
Okay.
No.
Okay, good. And then I have my light pen as well. And I'm checking for direct and consensual constriction in the pupils. And both eyes do react like they're supposed to. So I'll have you look at the edge of the pin there, and then focus on that, and then focus behind me. Okay, back at the pin, and back behind. And her pupils do dilate and constrict like they should. Okay, so while I'm doing that, I'm going to go ahead and test the 6 cardinal positions of gaze. So I'll do the first eye, which would be her left eye. And I'm going to have you follow the pin here, okay? So I'm going to go up, down, to the middle, back. And we're going to do the right eye. Up and down. Okay, and those are testing the cranial nerves 3, 4, and 6. So if I go ahead and have you cover your right eye, okay? I'm going to have you follow to the right, to the left, and down. And I'll have you cover your other eye. Follow the pin. Okay, good. All right, so then we have our ophthalmoscope. And my ophthalmoscope is not on, but we're going to pretend today. And so just to make it comfortable for the patient, we're going to go ahead and stay on the side that we're examining. So I'm going to look at look through my right eye while I examine her right eye. So I'm going to come in from a distance, look through, and as the light's shining, I'm looking for the red reflex from the eye. Okay, and then I would go ahead and come in and examine the eye for any damage in the cornea, any blood vessels that I can see that might be causing issues, and then I would go ahead and inspect the left eye as well, using my left eye. Okay, good. And then while I'm doing that, I can go ahead and check the conjunctiva of the eye. So I pull the eye down a little bit, and it's pink. I don't see any issues with skin. There's no blotching. There's nothing like that. And then the sclera as well. So I don't see any issues with jaundice, any yellow, anything here. Sclera looks white. Corneas were okay. The pupil size are all right as well. They're consistent with one another. They're symmetrical, and we tested them as we did our Perla test as well. So one of the other things that we could possibly do is utilize the Snellen chart, which we would have the patient actually stand or sit 20 feet away approximately, and then have them read with both eyes, cover one eye, and read, you know, the largest letter all the way down to the smallest letter that they would be able to do. And then that would complete the eye exam. So we've done the head, we've done some of the eyes, and we're going to go ahead and do the ears now. So I would just inspect the ear, the cartilage. There's no damage, there's no deformity. Their skin is consistent. Notice that she has a ear ring in. And then the same thing, go ahead and have you turn your head that way. Yeah. Same thing. Okay. And then you would also have your otoscope. So you first want to visually inspect the outside of the ear, make sure everything's symmetrical, that there's no problems, no issues, no damage, no drainage, no lesions, anything like that. And then also I would want to go ahead and then with my otoscope check inside the ear. So I want to check the ear canal. And I would be careful not to, since we're looking inside of her ear, I would be careful to not damage her eardrum or anything like that. And I could position my hand on her cheek possibly to restrain the otoscope from entering her ear. But I'm looking for the tympanic membrane and making sure that it's intact. Okay, and it is. So one of the other things that we can do is go ahead and do a whisper test. And so what I will do is have the patient actually go ahead and I'm going to have you cover your right ear. Okay, and then I'm going to stand on this side and I'm going to whisper something and you tell me whether or not you can hear me. Okay? Do you hear me?
Yes.
Okay? Then I'll go ahead and switch hands and I'll do it from the other side. Do you hear me?
Yes.
Okay. So I would say that her ears are working as they should. Visually, they look like they should. Physically, they're working like they should. And so I would not expect for there to be anything wrong with her ears. Okay, so next thing I want to go to is the nose. And so look for symmetry of the nose. The skin on the nose is fine. And then I'm going to go ahead and put my glove on here. And I'm going to tip the head of your head back just a little bit, and I'm going to look in your nose. And I'm looking for drainage, lesions, any possible inflammation that might be in there. And while I'm in there, I'm going to check for the septum as well. So I'll go in and look. Shine in there. I don't see anything. Okay, go ahead. Okay, and then so there's nothing that is occluding her airways, but we're going to go ahead and test for patency as well. So I'm going to occlude one nostril and have her breathe out the other. Then we'll go ahead and do it with, and her nose is clear, okay? And so we'll be looking for, with the speculum, and inspect the mucosa, the septum, and the turbinates. And there's no damage. There's nothing to note there. There's no scarring. There's no surgeries that we've asked them that, and there's no damage to the nose that we know of. Okay, go ahead. All right, so next to the mouth and throat, we're going to examine the buccal mucosa, which is going to be the inner linings of the jaw. And so with the mouth, we're going to look at the mucosa and make sure that it's nice, pink, and moist. And while we're doing that, we're going to inspect the teeth, the gums, the tongue, the floor of the mouth, the palate, and the uvula. So we'll go ahead and do that here. I'm going to have you open up your mouth. I'm going to have you say ah.
Ah.
Okay. So I'm looking at that. I'm inspecting her teeth. I'm inspecting the lining, the gums, everything. And everything looks in good working order. Okay, tonsils. Notice she has tonsils. And so there's nothing wrong there. They're placed where they should be, and they're in the middle. So we tested the gag reflex, had the patient say "ah," and then we were going to also ask them to stick out the tongue, which is testing cranial nerve 12. Okay, works good. Okay, so one thing real fast, which we would also test with hearing, is that we would, if we had the access to a tuning fork, we would test bone conduction and then air conduction with the hearing. We already did the whisper test, but we're going to test bone conduction as well. So we would place the tuning fork, we would hit it, place the tuning fork, place it on the bone right behind the ear, and then ask them how long they hear it. After that, we would go ahead and test it for air conduction. Hit it. And then we would ask the patient which one they heard longer. Air conduction should be longer than bone conduction. Okay? So moving down to the neck now. I'm going to inspect for symmetry, any distension in the venous system that we can see that we might know some problems. And then we're also going to check and palpate for lymph nodes. And we would do those in front of the ear, behind the ear. We'd actually work ourselves around the neck, and then also check underneath the jaw area here, as well the cervical. And then also we would check supra. What is it? Clavicular. Okay, and test those. So if those are inflamed or they're kind of hardened, kind of pea-sized, we know that there's probably something going on with infection. The lymph node system carries fluid out, and that's part of our protection system. So during the assessment, I've asked her to move her neck back and forth, so I've kind of already assessed range of motion, and then her strength as well. Okay. Some of the other things that we could test while we're at the neck area is the thyroid. And there's two ways to do that. We could do that from the front, or we could do that from the back. And we're looking for any inflammation, any swelling right there as well. So one of the ways to do that from the back is to ask the person to swallow while you're actually palpating this area. And you can feel that as you move across your fingers. And that'll give you a better idea of whether or not something is going on. So that completes our HEENT exam, and so I appreciate the time.